Today, we're going to talk about how something as simple as breathing can literally hack your vagus nerve to lower blood pressure and reduce inflammation throughout your entire body. And I really urge you to watch this video carefully from beginning to end, because if you really understand and grasp and apply all the things we're going to talk about, then this could be life-changing. Now, most people think breathing exercises are just for relaxation or stress relief. Maybe you've tried some meditation app or some quick breathing technique when you're feeling anxious. But what most people don't realize is that the way you breathe directly influences your vagus nerve, which controls inflammation, blood pressure, heart rate, digestion, and so much more. And it turns out that with the right breathing techniques done consistently, you can measurably change your blood pressure reading, improve something called your HRV or heart rate variability, and actually reduce inflammatory markers in your blood. So if you're dealing with high blood pressure, chronic inflammation, or you've been told by your doctor that you need to manage stress better, but nobody's really explained how, this video is for you. Let me start by addressing something that frustrates me about conventional medicine. When you go to your doctor with high blood pressure, what do they typically do? They write you a prescription. Maybe they tell you to reduce salt, lose some weight, and exercise more. And those things aren't wrong, but here's what they almost never explain. Your blood pressure isn't just about how much fluid you have in your system or how tight your blood vessels are. It's primarily controlled by your autonomic nervous system, specifically the balance between your sympathetic nervous system, which raises blood pressure, and your parasympathetic nervous system, which lowers it. And the same thing with inflammation. You might be dealing with chronic inflammation. Maybe you have joint pain, digestive issues, brain fog, and inflammatory markers like C-reactive protein that are elevated in your blood work. And conventional medicine treats this with anti-inflammatory drugs, maybe steroids, maybe biologics. But nobody's teaching you that you have a built-in anti-inflammatory system controlled by your vagus nerve, and you can activate it with something as simple as breathing. So here's the thing. Most doctors describe high blood pressure and chronic inflammation as conditions you have, something fixed that you're stuck with for life. But the truth is, these are dynamic states controlled by your nervous system, and your nervous system responds to what you do every single day. And one of the most powerful tools you have is your breath. Now, I'm not saying breathing exercises replace medication if you need it. What I'm saying is that for many people, learning to breathe correctly and consistently can dramatically reduce or even eliminate the need for medication over time. And for others, it can enhance the effectiveness of what you're already doing. But you have to understand how it works, and you have to be consistent. The vagus nerve is the longest nerve in your autonomic nervous system. It starts in your brainstem and it wanders. That's actually what vagus means. It wanders all the way down through your neck, into your chest, and into your abdomen. And along the way, it connects to your heart, your lungs, your digestive system, your spleen, your liver, and your immune system. Now, here's the key to understand. Your vagus nerve is the main nerve of your parasympathetic nervous system. That's the rest and digest, calm and heal side of your nervous system. And when your vagus nerve is activated, it does several incredibly important things. First, it releases a neurotransmitter called acetylcholine. And acetylcholine tells your heart to slow down, it tells your blood vessels to relax and dilate, and it tells your digestive system to get to work. So right there, you're lowering your heart rate and your blood pressure. But here's where it gets really exciting. Research from Harvard Medical School and the Mayo Clinic has shown that vagus nerve stimulation also directly reduces inflammation. And the mechanism is fascinating. When acetylcholine is released by the vagus nerve, it binds to receptors on immune cells in your spleen and throughout your body. And when that happens, those immune cells produce fewer pro-inflammatory cytokines. These are chemical messengers like TNF-alpha and interleukin-6 that promote inflammation throughout your body. So essentially, a strong vagus nerve acts like a built-in anti-inflammatory brake. It tells your immune system, hey, we don't need so much inflammation right now. Let's calm things down. And this is not theoretical. This has been measured in clinical studies. People with higher vagal tone, meaning their vagus nerve is more active, have lower levels of inflammatory markers in their blood. They have better blood pressure control. They have better heart rate variability. Now, what is heart rate variability, or HRV? This is one of the best markers we have for vagal tone and overall nervous system health. Your heart doesn't actually beat at a perfectly steady rhythm. If your heart rate is 60 beats per minute, those beats aren't exactly 1 second apart. There's tiny variations, maybe 0.9 seconds between one beat and 1.1 seconds between the next. And the greater that variability, the healthier your nervous system typically is. because it means your vagus nerve is actively working, constantly making tiny adjustments. High HRV is associated with better cardiovascular health, lower inflammation, better stress resilience, and even longer life. Low HRV is associated with chronic stress, inflammation, heart disease, and higher mortality. And you can improve your HRV with breathing exercises. This has been proven in multiple studies. So now the question is, how does breathing actually stimulate the vagus nerve? Why does something as simple as taking a deep breath have this profound effect? Well, there are several mechanisms at work. First, when you breathe deeply and slowly, you're physically stimulating the vagus nerve through stretch receptors in your lungs and diaphragm. Your vagus nerve has branches that innervate your respiratory system, and when you take a slow, deep breath, especially when you breathe with your diaphragm, you're mechanically activating those vagal fibers. Second, the pattern of your breathing directly influences the balance between your sympathetic and parasympathetic nervous systems. When you breathe in, your heart rate naturally speeds up slightly. This is called respiratory sinus arrhythmia. Your sympathetic nervous system becomes a little more active, and conversely, when you breathe out, your heart rate slows down and your parasympathetic system becomes more active. So here's the key. If you make your exhale longer than your inhale, you're spending more time in the parasympathetic state. You're giving your vagus nerve more opportunity to release acetylcholine, to slow your heart, to lower your blood pressure, to reduce inflammation. And this is exactly what all the effective breathing techniques do. They emphasize a long, slow exhale. Third, slow breathing reduces the activation of your amygdala, which is the fear and stress center in your brain. And when your amygdala is less active, your sympathetic nervous system calms down. Your body produces less cortisol and adrenaline. Your blood vessels relax. Your immune system shifts from a pro-inflammatory state to a more balanced state. And fourth, consistent breathing practice actually increases vagal tone over time. It's like training a muscle. The more you activate your vagus nerve with proper breathing, the stronger and more responsive it becomes. Studies have shown that people who practice breathing exercises regularly for just a few weeks show measurable improvements in HRV, reductions in blood pressure, and decreases in inflammatory markers. Now, here's the thing that mainstream medicine often misses. They'll tell you to manage stress, but they don't teach you how. They'll say, try some deep breathing, but they don't explain the mechanism or give you specific techniques or tell you how long you need to practice to see results. And because of that, most people try breathing exercises once or twice, don't see immediate dramatic results, and give up. But the truth is, if you practice the right techniques consistently, and I'm going to show you exactly how to do this, you can see measurable changes in your blood pressure and inflammation within 2 to 4 weeks. For some people, the effects happen even faster. For others, especially if you've had high blood pressure or chronic inflammation for years, it might take a few months, but it works if you're consistent. So let me show you the first technique. This is called 4-7-8 breathing, and it's one of the most effective methods for activating your vagus nerve and lowering blood pressure. Here's exactly how you do it. First, you're going to completely empty your lungs through your mouth. Just breathe out all the air. Then you close your mouth and breathe in quietly through your nose for a count of 4. So 1, 2, 3, 4. Then you hold your breath for a count of 7. 1, 2, 3, 4, 5, 6, 7. And then you exhale completely through your mouth for a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. That's one cycle. And you're going to do 4 complete cycles. So 4 rounds of 4, 7, 8. Now here's what's happening physiologically. The extended hold and the long exhale are maximally activating your parasympathetic nervous system. You're spending most of the time in that vagal activation state. And the complete exhale ensures you're emptying your lungs fully, which stimulates those vagal stretch receptors even more. Now here are the common mistakes people make with this technique. First, they breathe too shallowly. You need to breathe deeply, using your diaphragm. Your belly should expand when you breathe in, not just your chest. Second, some people try to hold their breath too long and they start feeling anxious or dizzy. If 7 seconds feels too long, start with 5. If 4 cycles feels like too much, start with 2. The key is consistency, not perfection. And third, and this is really important, don't hyperventilate. This is not rapid breathing. This is slow, controlled, deep breathing. If you feel lightheaded, you're doing it wrong. Slow down, breathe more gently. I recommend doing this technique twice a day, every day. Once in the morning when you wake up and once before bed. It takes less than 2 minutes. And you cannot tell me you don't have 2 minutes. Mark your calendar right now, commit to doing this for 30 days, and then come back and comment on this video with your results. Tell me what happened to your blood pressure, your stress levels, your sleep quality. The second technique is called box breathing or square breathing. This is used by Navy SEALs, by first responders, by people who need to maintain calm under extreme stress. And it's incredibly effective for balancing your nervous system and reducing inflammation. Here's how it works. You breathe in for a count of 4, hold for 4, breathe out for 4, hold for 4, and repeat. So it's equal parts, 4, 4, 4, 4. That's why it's called box breathing. Each side of the box is the same length. Now, the beauty of this technique is that it creates perfect balance between sympathetic and parasympathetic activation. You're not emphasizing one over the other, you're teaching your nervous system to regulate itself smoothly. And over time, this improves your overall vagal tone and your HRV. I recommend doing box breathing for 5 to 10 minutes at a time. You can do this during a work break, in your car, before you go into a stressful situation, or anytime you feel your stress levels rising. And again, breathe with your diaphragm. Your belly should expand on the inhale. Common mistakes? Holding the breath too forcefully. The hold should be relaxed, not tense. And breathing too shallowly. You want full, deep breaths. For people dealing with chronic inflammation, I especially recommend box breathing because the balance and rhythm it creates helps regulate your immune system over time. Studies have shown that consistent practice of box breathing can lower C-reactive protein and other inflammatory markers. It's not instant, but after a few weeks of daily practice, people often see significant changes in their lab work. The third technique is diaphragmatic breathing, also called belly breathing. This is the foundation of all the other techniques. If you can master this, everything else becomes easier. Here's how you do it. Lie down on your back or sit comfortably with your back straight. Place one hand on your chest and one hand on your belly. Now breathe in slowly through your nose and focus on making your belly rise while your chest stays relatively still. Your diaphragm is pulling down, creating space in your lungs, and your belly expands. Then breathe out slowly through your nose or mouth and let your belly fall. The key is that your belly should be doing most of the movement, not your chest. Most people breathe shallowly from their chest all day long, and that actually promotes sympathetic nervous system activation. It's like you're constantly in a low-level fight or flight state. But when you breathe with your diaphragm, you're mechanically stimulating the vagus nerve with every breath. I recommend practicing diaphragmatic breathing for 10 to 15 minutes a day. You can do this while you're watching TV, before you go to sleep, or anytime you have a few quiet minutes. And over time, you want this to become your default breathing pattern throughout the day. Common mistakes? Breathing too fast. Slow it down to about 5 to 6 breaths per minute. That's roughly a 5-second inhale and a 5-second exhale. And forcing the breath. Let it be natural and easy, not strained. Now here's something really important. All 3 of these techniques work, but they work best when you do them consistently. This is not a one-time thing. This is not something you do once and expect your blood pressure to drop 20 points. This is a daily practice that trains your nervous system over time. So let me talk about what the research actually shows in terms of timeline and results. Studies from Harvard and the Mayo Clinic have found that people who practice breathing exercises for at least 10 to 15 minutes per day see measurable improvements in blood pressure within 2 to 4 weeks. We're talking about reductions of 5 to 10 points in systolic blood pressure on average. For some people, it's even more dramatic. And the improvements in HRV happen even faster. Within 1 to 2 weeks of consistent practice, people typically see their HRV scores improve. You can track this with a smartwatch or a dedicated HRV monitor. And as your HRV improves, that's a sign that your vagal tone is increasing. Your nervous system is becoming more balanced, and your body's natural anti-inflammatory mechanisms are getting stronger. In terms of inflammation, the changes take a bit longer to show up in blood work, but they do happen. Studies have shown that after 4 to 8 weeks of daily breathing practice, people have lower levels of inflammatory cytokines like TNF-alpha and interleukin-6. Their C-reactive protein levels come down. And these are not small changes. We're talking about clinically significant reductions that can improve your overall health and reduce your risk of chronic disease. But here's the thing. These benefits don't happen if you do this occasionally. You can't just do breathing exercises when you remember or when you're feeling stressed. You have to make this a daily habit, just like brushing your teeth. And I know that might sound like a lot, but we're talking about 10 to 15 minutes a day. Most people spend more time than that scrolling social media. So let me give you a practical plan. Choose one technique to start with. I recommend 4-7-8 breathing because it's quick and powerful. Set a reminder on your phone for morning and evening. Do 4 cycles in the morning, 4 cycles at night. That's it. Less than 5 minutes total. After 2 weeks, add in some diaphragmatic breathing before bed. After a month, if you want to go deeper, add in box breathing during your lunch break and track your results. If you have a blood pressure monitor at home, check your blood pressure before you start and then once a week. If you have a device that tracks HRV, watch those numbers. Keep a journal of how you feel, your stress levels, your sleep quality, your energy, because I promise you, if you're consistent, you're going to see changes. Now, let me talk briefly about some lifestyle factors that can enhance the effectiveness of these breathing techniques. Because breathing exercises are powerful, but they work even better when you support your vagus nerve and your nervous system in other ways. First, omega-3 fatty acids. These are found in fatty fish like salmon, sardines, and mackerel, and they have been shown to improve vagal tone and reduce inflammation. If you're going to do breathing exercises to lower inflammation, make sure you're eating enough omega-3s or taking a high-quality fish oil supplement. Second, cold exposure. Taking a cold shower or ending your shower with 30 seconds of cold water stimulates the vagus nerve powerfully. You can combine this with your breathing practice. Do your breathing exercises right after a cold shower, and you'll amplify the effects. Third, mindfulness and meditation. These practices naturally complement breathing work. They calm your amygdala, they reduce stress hormones, and they improve your ability to stay present and focused during your breathing practice. And fourth, gut health. This might surprise you, but your gut and your vagus nerve are intimately connected. Your vagus nerve is the main communication highway between your brain and your gut. And if your gut is inflamed or your gut bacteria are out of balance, that can impair vagal function. So eating a diet rich in fiber, fermented foods, and avoiding processed foods and sugar will support your vagus nerve and enhance the benefits of your breathing practice. I've done other videos on gut health and the gut-brain connection, and I'll link to those at the end. But just know that this is all connected. You can't just do one thing and ignore everything else. Your body is a system, and everything affects everything. So let me bring this all together. You clicked on this video maybe thinking you were just going to learn a breathing trick to help with stress or blood pressure. But what I hope you understand now is that this is so much bigger than that. This is about learning to communicate with your nervous system. This is about activating your body's built-in healing and anti-inflammatory mechanisms. This is about taking control of your health in a way that most doctors never teach you. Your body is incredibly intelligent. It has systems designed to regulate blood pressure, to modulate inflammation, to maintain balance. But those systems only work when you activate them. And for most people living modern lives, sitting all day, stressed out, breathing shallowly, eating processed foods, those systems are barely functioning. Your sympathetic nervous system is stuck in overdrive. Your vagus nerve is weak. Your inflammation is high, and your blood pressure is elevated. But here's the good news. You can change this. It doesn't take expensive treatments or complicated protocols. It takes understanding and consistency. You learn how your body works, you practice the techniques that activate your vagus nerve, and you do it every single day. And over time, weeks, months, your nervous system rebalances. Your vagal tone increases. Your HRV improves. Your inflammation comes down. Your blood pressure normalizes. And this is not theory. This is proven by research from Harvard, from the Mayo Clinic, from dozens of other institutions. And more importantly, I've seen this work with real people. I've seen people get off blood pressure medications. I've seen inflammatory markers normalize. I've seen people who were told they'd have to deal with these conditions for life completely turn things around. But, and this is critically important, you have to be patient and you have to be consistent. For some people, changes happen quickly. For others, especially if you've had these problems for years or decades, it might take longer. You might need to practice for 3 months, 6 months, even a year before you see dramatic changes. But I can tell you from experience, if you stick with it, it works. So here's what I want you to do. First, choose one breathing technique and commit to practicing it twice a day for the next 30 days. I recommend starting with 4-7-8 breathing because it's simple and effective. Set reminders on your phone. Make it non-negotiable, like brushing your teeth. Second, if you can, track some metrics. Check your blood pressure once a week. If you have a device that tracks HRV, watch those numbers. Keep a simple journal. Just a few notes about how you feel, your stress levels, your sleep quality, because when you see the numbers change and you feel the difference, that's what will keep you going. Third, be patient with yourself. Some days you might forget. Some days the technique might feel awkward or frustrating. That's normal. Just keep coming back to it. The benefits are cumulative. Every breath you take with awareness and intention is training your nervous system. And fourth, come back to this video in 30 days and leave a comment. Tell me what changed. Tell me what your blood pressure did. Tell me how you feel, because I want to hear from you, and your results will inspire other people who are just starting. If you found this video helpful, make sure you subscribe and hit that bell so you don't miss future videos. I'm going to be doing more on the vagus nerve, more on the autonomic nervous system, and more on practical techniques you can use to take control of your health. And if you want to dive deeper into related topics, check out the video I did on the gut-brain connection and how your gut bacteria influence your nervous system, and the one on autonomic nervous system balance and why it's the key to long-term health. I'll link to both of those right here. Thank you for watching, stay healthy, stay consistent, and I'll see you in the next video.